International Patient Coordinator from CatchLife Aesthetic. Today I have a very special guest with me.
Hi, I'm Dr. Murat Yüzüner. I'm a plastic reconstructive and aesthetic surgeon at CatchLife Aesthetic.
So, how was your day?
Oh, thank you. It was a busy day. I got operations, my patients, my controls. It was a good and busy day. Thank you.
Yeah.
What about you? What's the day?
It was a busy day for me, but compared to yours, nothing major.
Yeah. Thank you.
But sometimes business keeps us happy, so it's much better than being...
The happy business, happy day. Ends the day very busy and get us very happy.
Yeah, and we will always do everything to make our patients happy, so business and happiness goes hand in hand. Yeah, so before we start our live stream, I have a very special announcement to make. On 11th of October, we will be in Bristol to meet with you. Our surgeon will be there to answer all of your questions. You will have a chance to speak with him face to face, and
we will be there for your all questions about aesthetic needs and free consultations. And we will be there. We are waiting all of you.
Yeah, and 11th of October Bristol, and on the 12th of October we will be on the Birmingham.
And the Birmingham, yes.
Yeah.
We will be there waiting you.
Yeah, please be there. So, we have some questions about tummy tuck surgery.
Well, today's topic is tummy tuck, yeah?
Yeah, it's tummy tuck, and we have arranged some questions from our patients. They have sent their questions to us, and these are the most common questions they are curious about.
Exactly.
So, if you are ready, we can start.
Yes.
Yeah. Our first question is, when a patient says they want a natural look, what does that mean to you as a surgeon?
Yeah, it's a strange question. Because natural looks in aesthetic surgery means this, not the all natural aesthetic. They mean with this the natural aesthetic look. They want natural, but also they want aesthetic. But it's not mean that natural equal to the aesthetic, or aesthetic is every time is natural. They want aesthetic, but not fake. They mean the natural, not fake.
So they would like to achieve good results, but they don't want them to be seen as fake or...
The termination is natural they mean, I think, not fake. Not fake mean natural, not directly mean that, but the patient generally means that.
Yeah,
not
they
fake
think
one.
It like that.
Because of that, it's our aim. We always think about it. If it's start to be looks fake, we always alert our patient. This is not looks natural.
Or maybe you could say, like, are you sure?
Exactly.
This is really the look you would like.
Exactly. For the operation, we talk many times for these conditions. We alert. Sometimes patients say, "Yeah, I want fake." Then we can do it. But we talked about that topic. But generally, they want natural aesthetic one.
I see. So,
because it's aesthetic, there is a big range.
Yeah, it's like subjective.
Exactly.
Yeah. So if the patient just wants...
Yes, we are only guide about choosing what they want. They say what they want. We suggest some things, and when it's match, then we do that.
I see. But the final decision is always up to patients, I guess.
Exactly. Yeah.
Exactly. So if they really want
as a final, we say, you want this, I can do this. The patient say yes, then we do that.
I see. But they should consider the surgeon's opinion as well.
Exactly. We always guide for the patients.
Yeah. So our next question is, who is the ideal candidate for a tummy tuck surgery?
You can see that. If someone's tummy is sagging, it's a candidate for the operation. But sometimes they hide it. Sometimes we're surprised. They use corsets, very tight corsets. You can't imagine that kind of sagging on that person. When they open it, you see that, you need it.
You definitely need that.
Front of the mirror, person look at the mirror and if see sagging tissues on the abdominal area, it means that they need liposuction or maybe tummy tuck surgeries.
Yeah, so sagging is a very big sign that you would need tummy tuck surgery.
There are many levels of sagging. Some is very minimal, some is very huge. Many kilos sagging on that area. Also, it's not only aesthetic problem; it's also an health problem.
Oh yeah.
Yeah, because of that we do both.
I see. So for both aesthetic reasons and
exactly.
health.
Sometimes for health, yes.
I see. And it affects the procedure you are going to implement as well, I guess. So the degree of sagging will affect the tummy tuck surgeries or the methods, or like.
The technique is almost same. It's only affect the time, the operation time.
I see. So it will affect the time. All right. So our other question is, how long does the recovery usually take?
Yeah, recovery changes person to person, but generally it goes 3 weeks and up to 2 months. The early time is 3 weeks. After 3 weeks, lots of patients feels almost and start their daily routines.
So 3 weeks.
After 3 weeks, yes, we can say 3 weeks. You can go to your daily works. But as a biological, it goes many months, from 6 months up to 1 year. It goes biological. You can see it.
I see. So it's for full recovery.
Yes,
maybe we are talking
you
about.
can see the result, and you can start to feel normally after. From starting from the 3 weeks up to 2 months, you will feel almost okay.
Much better.
Yeah.
I see. So, I think I have another follow-up question to this. I think we have some things or activities. For example, some sports. We get that this question a lot. For example,
it can change. Yes, patients usually ask when I go to sport. It's all about what you are doing at the sport. If it's simple movements, you can go after 1 month. When you feel okay, you can go. But if you want to use any device, using any weight, lifting weights, climbing, or like this, it's better to wait for 3 months.
3 months.
Because after 3 months, your tissue's quality will be very powerful for strain. And you can do a little hard exercise after 3 months.
I see. So,
but if you are a professional, up to 6 months, maybe 1 year, you have to wait for it.
I see. So it really depends on the intensity of the activity.
Intensity and what kind of sports do you mean?
I see. And the patients should always listen to their own bodies as well, I guess, right?
Exactly,
so if they feel like something is wrong, even if they are within the range.
The rule is this: if you try to protect too much, the healing period goes long. Because I always suggest starting the daily routines as much as quickly, because we are stirring, we are making the tissues repair very powerful. Because of that, I want my patients after the 2 days. I start walking, doing some exercise. After 1 month, I suggest lots of exercise without any device or weight. Then they go themselves. What can you do? They can decide it.
I see. But being active will actually help with the recovery as well, as far as I understood. So there's like a good balance with that.
Exactly.
But they could always ask their surgeons for their opinion, and they would be informed about
because
those.
It can change. Sometimes if we don't make muscle repair, for example, they can start the exercise very quickly. If you make too many areas muscle repair, it can goes up to 2 months maybe.
I see. So maybe they should all consider all of these. Yeah. Our next question is, it's a very common one actually. What is the difference between a mini tummy tuck and a full tummy tuck?
Yeah, it's a good question because the patients usually ask this. The mini tummy tuck means the sagging tissues on the lower level of the belly button. On the mini tummy tuck, we don't touch to the belly button. We excise tissues between belly button and pubic area. We tighten only that area. We don't elevate too much flaps. And the traditional, the normal tummy tuck means, firstly, we incise and put inside the belly button, then we elevate all tissues up to chest. Then we tighten it and we excise lots of tissues. Then we tighten and we put it back, its place, its new place, the belly button. It's very different.
Yeah. So
this is minimal. The other one is normal surgery.
I see. And sometimes, I don't know if it's right to say that, but most of our patients have a tendency to think that a mini tummy tuck will resolve their issues, but in reality, most of them need a full tummy tuck.
Yeah, the decision is very important because lots of wrong decision for the mini tummy tuck goes to full tummy tuck after a few months.
So maybe they should consider this
Yes.
and be very careful about choosing the right surgery, and the surgeons will.
I usually suggest, if it's the limit of the mini tummy tuck, I always suggest normal tummy tuck because you are going to get an anesthesia, you are going to have a time for healing. Because of that, I usually suggest the most long-lasting lasting result of full tummy tuck.
I see. So it was very informative.
Exactly.
Yeah, thank you. All right. Our next question is: will there be visible scars after the surgery?
Yes, the scar is visible, but it's all about where you are look at the scar. If you look at it very close, you can see it, but it's on the normal distance, you can see the scar. But the question may be about this. Can we hide the scar after the abdominoplasty? Yes, you can hide it. With your panty, with your underwear, with your bikini.
Yeah, so
you can, exactly. We are doing it as much as lower area on your abdomen. Then so our aim is hiding it with underwears, bikinis, like that.
I see. And most of our patients are asking about C-section scars.
Exactly.
So
many times, if patient has a sexual scar, we enlarge it.
So it will be like a longer.
Exactly.
C-section.
Hip to hip, the level is almost the sexual level.
I see. And it really depends on the tummy tuck surgery type, right? Scar locations and scar types can change according to tummy tuck surgeries.
Yeah, usually we use as much as lower part, but if it's a secondary case or if there's another problems, for example, if they need a hernia repair or like this, sometimes we add additional scars on it, but traditional hip to hip and on the sexual levels.
Yeah, so it's the most traditional one. I see. And our next question is: can a tummy tuck improve core muscle function or posture issues?
Yes, but not directly. It's an indirectly, yes. Because if there's a loose muscle, we repair it. When you repair the loose muscle, the person use their muscles more powerfully.
So
more effectively.
Tighten the core muscles.
Exactly. And it affects the posture of the operation, exactly, because the weight goes off on the front side and your muscles get more tight. And with this advantage, we always suggest, please correct your posture after the operation. Lots of patients, maybe all of them, change their posture and have a very good posture.
So it's not just about like tummy tuck and aesthetic function of the surgery, but also it will affect the posture, and that way it will be very healthy for the patients.
Exactly.
Yeah, so it's like a very good side benefit of the surgery.
As a psychological, because there is a flat tummy, and the person wants to make a better posture. And it will help getting better person.
Yeah, and they will be more confident as well. So there are so many benefits
their self-confidence gets better and better. Then they usually want themselves changing their posture like this.
And it will be nice to show their good body as well, I guess. So our next question is: should I wear an abdominal binder or compression garment after a tummy tuck surgery?
Yeah, usually we usually use in aesthetic surgery this kind of devices. The corsets, the garments, the compression is very important. Especially we do elevate some tissues on the healing period. We were preventing the seromas or any kind of fluid collection. We usually use it, but it's not hard to use. It's lots of comfortable. When it's not exact rule, we give some shifts. You can use a few hours, then you can rest for a few hours like this. According to patient's comfort, we can change it. But I usually after the abdominal operations, especially on the abdominoplasty, I usually use 3 weeks. Using every time. After 3 weeks plus 2 weeks or 3 weeks using with shifts on the daylight on at the night off like this.
So it could be like 12 hours.
Maybe.
But after 3 weeks or around
patient arranges it according to lifestyle.
I see. Because sometimes maybe you would want to take it out if you like to go out.
I always say my patients, if you feel anything discomfort, please open it. Open it, look at, and keep like that for a few hours. Then again, if you feel every time, don't use the corset. And give information to us why you can't do it. Then sometimes it can be.
I see. So,
I never saw in 2 weeks before. On first 2 weeks, maybe lots of our patients uses it.
So it will be very good for the recovery, and they should keep it on all
They know
times.
it because I explain why we are using that. Then when patient understand it, they always use it.
I see.
Because I'm not saying it. Use this for this 3 weeks. Not. I'm explaining it because of this, because of not getting inside fluid collection and this. And the patient, when understand, they themselves always
they would want to wear it.
Yeah, always wear it. And they ask me, can I leave it? It gets 1 month. Then I say, yes, you can leave it.
So they are very open to wear it for their health and recovery. So let me check our questions again. Our next question, and I think it's one of the most important questions. So what's the most important thing patients should communicate before surgery with their surgeon?
We always ask this: do you have extra weight? If you overweight, this is very important for us. For the getting anesthesia first, then for our operations, good results. It's very important. If they can give weight, lose weight, we always suggest losing weight before the operation. It's the most important thing, what we told before the operation. Then the others is the same with all kind of operations. The medical condition, do you have any chronic illness, what medicines to use, medical usage like this.
But one of the most important ones is weight.
Weight, yeah.
Is there an upper limit for tummy tuck surgery, BMI?
No, sometimes the textbook says the BMI maybe, but sometimes the BMI is high when they send their photos. Their photos looks okay. It's all about how their length and their weight.
It's about distribution, maybe?
Maybe, it can change. It's not rule. Also, but if the BMI is very high, 35, upper than the 35, I usually don't want the photos because it's an obese.
So it's quite high.
For example, it's 32 or 33, then I always suggest, please send your photos. According to the photos, I decided.
I see. So, even if you are in the higher range of the BMIs, you could still be suitable for a tummy tuck surgery. So don't think
it's better asking it.
Yeah.
Because sometimes patients says I give weight, but my BMI didn't change. It can be.
Yeah, and there are, as far as I know, if people lose so much weight, there would be like some skin and other stuff, and tummy tuck surgeries would help with that, and they would help them to lose weight in a sense as well.
Exactly.
So it will be.
Yes, and sometimes a patient with BMI is high, and they are sending photos. They look very healthy.
Mm-hmm.
Or during the examination, I'm looking, everything is okay. It looks very healthy. Every test is okay. Then sometimes at that condition we can do that.
Yeah. So
if we think that the patient's recovery will be fine, we can do that.
So there's always a chance for a tummy tuck surgery even if your BMI is high. So it's really good to know.
Yeah.
All right. Let's see. We have other questions. Oh, this is a good one. What role does skin quality and elasticity play in tummy tuck operations?
Yeah, it's maybe about the age. This question, I think, want to ask the age. Yes, if the skin quality is good, the result is better every time. But if the skin is very loose and the elasticity is not good, sometimes some deformities can be seen as a complication. But usually we tighten all skin. Mm-hmm. After our operation, we get a total flat tummy. If the elasticity is good, yes, the healings yes. But there's a condition is if the elasticity is good, sometimes the scar will be worse.
So it's like a double edge.
The skin elasticity have an advantage of getting flat look, but disadvantage on scar. It can change. It's all about the age. We can say the old age skins exactly heals slowly, then the elasticity and quality is not good, and reoperation needs, deformities will be a little bit high as a complication according to young patient.
I understand. So it plays a big role.
Yeah.
And do certain health styles or activities affect skin elasticity and quality?
Yeah, not directly. No, not directly. It's genetically the elasticity, and the main entity is age.
I understand. Does smoking affect skin quality?
Exactly.
So maybe because
smoking affects all kind of aesthetic surgeries, especially on facelift, on neck lift. We always ask it. Yes, it can affect, but it's not a rule. We don't make anatomy track on smokers. It's not true, but we say always the risk.
Yeah,
and we say as much as before the operation, as much as stop it.
Mm-hmm. And it will be much better for the recovery as well. And like smoking is really bad for your health, so it will be best if you could just quit it. So we should do that warning as well. All right. So we seem to run out of questions. We have only 3 left, but these are good questions, so we shouldn't skip them.
The hard ones at the last.
But they always say the hard ones to the last. So one of them is this. Do secondary revision tummy tucks differ a lot from first time tummy tucks?
For primary surgeries, yes. It can change maybe all kind of aesthetic surgery. The secondary, maybe the tertiary, we say, the first time surgeries very difficult because the anatomic area is not the original.
So there are some changes with the...
Exactly. Because we are doing the operation again in a scar tissues, things like that. We can't aware of what kind of tissues we are working on because all area is scar. Then the complication rates gets more higher.
So it will bring some risks if it's like a second time.
It's like driving in a smoky road, things like that.
So I think it's a very important thing to
consider. It's different, yes. Because of that, your first surgery, your primary surgery is very important for planning. Please go and get your tummy tuck on the professional hands, because of it's very important. If you need a revision, it's very important what they did before. It's very important. I did every time I do my operations thinking like that. If they need any revision, not from us, from anybody, they can use this. They can use this. I try to protect them if they need next time.
So it's really important. Even if you think like getting a first surgery is a big decision, but if you are getting a surgery, please choose a good surgeon with good qualifications.
It's all about humanity and loving your job. I can do like that.
All right. Our next question is: can a tummy tuck be safely combined with other procedures like liposuction or breast reduction?
I like it too much, combining tummy tuck, because if a person need a tummy tuck, it means they can need extras. For example, arm lifting, thigh lifting, any liposuction on an area, because the person who needs only pure abdominoplasty or tummy tuck is rare. Because of that, we usually combine, especially with the liposuction, 360 liposuction, we usually combine with the tummy tuck for making better curves and for skinny waist and flat tummy areas. I like it, yes, we usually combine.
And I have a follow-up question to that. Sometimes our patients say that, shouldn't only a tummy tuck be enough? Do I really need liposuction surgery with it?
Sometimes, patients scared about liposuction.
Yeah.
Because they don't ask many questions about tummy tuck, but for liposuction they ask many questions because they're scared. Yes, it's right, but on the experienced hands, and if you know what you are doing and how much it's safe, it's very safe procedure liposuction because of the bad samples maybe.
Maybe they have some misconceptions
or
like
because of that, because especially the media likes that they get a liposuction and because of that, but they don't say about the tummy tuck, because the tummy tuck is a very big operation according to liposuction.
But still they have a opinion about liposuction, but I think
during the examination I always suggest, we never force, but I suggest, do you want this, but you will get an anesthesia. Only allowing a few hours your operation, you will get also these.
And a much better results.
And lots of patients say, yes, you are right. Can we do it? Yes, we always combine it. And the result will be better and better than the pure tummy tuck.
I understand. I'm sure it will answer some of the questions you had in your mind about the operation. If you consider like, do I really need a liposuction? Maybe you do, and it will be much better if you have a liposuction alongside tummy tuck, and it will save time, or cost-wise, it will be much better than separate surgeries. Our final question is this. We are at our last question, and it is: can tummy tuck and functional procedures like hernia repair can be performed together?
It's very hard to say that we do it together, but lots of cases we can do it, because I don't like it. I want to first say that I don't like it, but if you have to, yes, we can do it. We open the area, then we repair it, and we can do the tummy tuck. We can, as a technically, yes, we can do it. But the hernia, if it's not important hernia, yes, we can exactly do it. But the hernia is very big. Firstly, it's better repairing the hernia when then healed, because the hernias, nukes, and relapse is we can see it too much because If the hernia totally healed, then it's better making the tummy tuck, because if you have a hernia nix or tummy tuck complicated, your tummy get flattened, but only because of the hernia it will get more bumpy. It's not about the tummy tuck repair, it's all about the hernia repair because of that. But during, if we don't aware of any hernia, and if we see any hernia during the operation, we always correct it. We always. You don't usually suggest, but technically we can do it.
So it's still possible, but depending on the degree
according
of
to
the
patient,
hernia.
it's better deciding according to the patient's hernia. Where is it? How it's big? What's the problem? Do you aware about your hernia, or did you see it incidentally during your checks?
Yeah, so it should be better to consider, but in theory it should be possible, but like you said, all of these factors.
Before the operation, I examined all my patients' tummies with my hands, and especially for the hernia. Yes, if I see there's a hernia, first I'm saying you have a hernia like that. If you want, we can repair also. If you want, you can firstly repair your hernia, then we can try. And lots of patients says, yeah, it's better for making firstly repairing our hernia. If they say yes, I want both together, we can do it.
It could be done together.
Yeah.
Yeah. So I'm checking our phone to see if we have any questions from our viewers, but seems like we don't have. We could wait for a bit.
Okay, it's mean that all questions and answers is okay for you.
Yeah. Which is really nice.
Yeah.
We covered such a wide range of topics today, and I'm sure it's helped with some of our patients and it answered some of their questions.
Also, you can ask your questions offline. We can reply it, we can write it.
Yeah, you could ask your questions to us anytime from our Instagram page. You could send your messages. If you have anything in your mind, you could apply to our website to ask your questions to the surgeon or to our coordinators, and we would get answers for those questions. Before I finish our live stream, I would like to thank you for your time and all your expertise, for your answers to these questions.
Thank you.
And I will do the announcements one more time. We will be there in the 11th of October in Bristol. Our surgeon will be there.
We will be there for face-to-face consultation, all kind of questions about aesthetics, and any kind of aesthetics.
You will have a chance to meet in person.
Yeah, thank you. Yes, perfect.
And 12th of October, we will be there in Birmingham.
Yes, we are waiting you.
And please come there and we will be there for you. Thank you.
Thank you.